Are we live?
Yes, we are.
Do you on do my thing?
We're live right now.
Open my video.
Yes, please. Welcome,
Cool.
welcome. It's good to have you.
To be here.
It's good to have you. It's good to have you here.
Are we live?
Yes, we are.
We are. Do you on do my thing?
We're live right now.
Open my video.
Yes, please. Welcome,
Cool.
welcome. It's good to have you.
To be here.
It's good to have you. It's good to have you here.
Are we live?
Okay, I'm going to need you to.
We are.
Are you on YouTube?
Hello?
You need to mute if you're on YouTube. You need to mute yourself.
My browser is off.
Oh, your browser's off?
Mm-hmm. Can you hear me?
Okay, I'm trying to mute mine right here because the volume, that's why we're getting the feedback.
Okay.
You need to mute if you're on YouTube.
Okay,
Okay,
that's
so
right.
I've muted myself. So we're going to stop hearing the echo now. Do you still hear an echo on your end?
Not really.
Okay, so we're good.
Okay.
We're good to go. So I'd like to welcome everyone to More Than a Phase with Tony Fasherson. And More Than a Phase provides mental health awareness, training, education, advocacy, and support. And I'm so proud today to have as my guest, Folake Oluokun M.D. CHPC. She's an emergency medicine physician with over 35 years of experience in family practice and emergency medicine. She's a certified high performance coach. She's a speaker, she's an author. She's an executive member of the John Maxwell Team. In addition to all that, as though that were not enough, she's a loving mother and grandmother. And out of all these titles and all the hats that she wears, my favorite is that of big sister, because she's also my big sister. She's my eldest sibling. And I'm so excited to have her here with us today. First off, I want to start off by thanking her. Another thing about Dr. Oluokun, Dr. O, as she's affectionately called by her patients, is she's a second generation physician. And she has the same thorough and compassionate bedside manner as her dad, or our dad, who was a professor of OBGYN, obstetrics and gynecology, and our mom, who was like the director of the emergency medicine department as a nurse. So she has that genetic coding, I guess, and it's been expressed in everything she does. She does it with a spirit of excellence, and the compassion is interwoven, and she's very thorough and very direct. So she'll be talking with us today about coping with COVID-19 from the front lines. Like I said, she's in emergency medicine. So she's actually, she's off today, but she's working tomorrow. So that's just to let you know how close she is to ground zero. And like I said, I want to thank her for her service. I want to thank her for her selflessness. I want to appreciate her and use her as a point of contact for everyone else out there who's seen to it that they contain the spread as much as possible and they help make people as comfortable as possible. And for even those out there who are working towards a cure, we appreciate you and we're grateful. You're welcome, Dr. Oluokun.
Thank you. Thank you, little sis.
Not too much of little sis. So I want to start off by asking, how are you doing?
That's a loaded question. How am I doing? My last shift was kind of hard because I had to cover for a colleague of mine, and hard because more than ever in this season, we're having more deaths than usual. Some of it we cannot for certain say they are COVID related, but we can't say they're not. So it's hard. It's hard because in medicine, we like to be in control, and we're not in control. I think that's what's hardest for me. The playing field has changed. That's because COVID is not well defined. And so it's harder to practice an already hard profession. Yeah, it's hard. I have to be honest.
Okay. You mentioned the fact that you've seen more deaths than usual. What's the morale like amongst your colleagues? Have you had any of them fall sick? Have you had any of them infect a family member? Has there been any rise in that in your emergency room?
I think in the emergency department which I work, I think we've been extremely careful, very, very careful. And I think that the support that we give each other kind of helps us navigate. None of us has come down with the virus, thank God for that, fingers crossed. Some of us have had to self-isolate from our family members. In other words, stay in the basement while our family members are in the top part. And some of us outright haven't gone home and are quarantined in hotels. And some of us are quarantined in mobile homes that the community has provided for healthcare workers. So in that regard, it's awesome. Awesome how the community has come to support us. And a lot of times the community sends us masks. We have cloth masks that we can wear, and everybody has a hat of some sort to wear from the community. They just decided to get fabric, sew up stuff, and donate to the hospital. And so that outpouring has really helped us cope quite a lot, because I think in crisis, people kind of gather together and the best of people is shown, which is amazing. It's amazing that it took COVID for communities to appreciate healthcare workers. I mean, I know some restaurants would send food because people had donated maybe $5 or a certain amount to provide things for healthcare workers, which is unprecedented because I've done this for quite a bit and I've never seen that much outpouring. I haven't seen that before.
Okay. So so the community has rallied around the team, has rallied around the emergency department workers, but within the hospital, like during the shifts, how are people coping? How are the nurses and the doctors coping with the fact that you have to treat everyone coming through that door as though they were positive? How are they handling that emotionally? How are they?
I think I work the night shift, and I don't work the day shift, so I don't know what happens daytime, but at night shift, what we do is kind of amazing. Is in healthcare, the team is actually your family. I mean, they see you at your worst. By the time you get home, you're the nice mom, you're G mama, you're everything. But in the emergency department, you're the doctor, right? And then you have your nurses, you have your techs, you have your radial techs, you have all these people that work with you. You get to know them. Each of us has other things that has been happening in our lives aside from COVID. So one of the things that I do when I work with my folks is we try to talk about things other than COVID, like our normal lives, to get some normalcy, because the first 4 weeks of COVID was awful. Every time you came to work, nothing was the same because the CDC was sending out stuff, WHO was sending out stuff, the health department was sending out stuff, the hospital, and every organization was trying to figure out, protocols. So what you did yesterday, when you came back the next day, was not the same. So it kind of helped us to trust one another to get information, because the information you get tonight is not the information for tomorrow. So if you didn't trust the people you worked with, you almost felt like that's not what we did yet last night. But the thing that helps us most is the very fact that we all know that we came to work to serve. I think that's the most important thing. And we take time to encourage one another, especially when we had to figure out how to make the triage table, because we had to make a table to triage people into what side of the ER they came into. Did they come into regular, or did they come into the part that was COVID related? And that was kind of hard because sometimes people didn't tell you the truth. Some people wanted to be tested at all costs, so they'll say things that make them positive, and so you have to put them in there. And it was kind of hard to streamline, because initially we didn't have enough kits, and people just thought they had to be tested no matter what. And we had to have guidelines. Then we had to make the hardest decision of all, to not allow visitors.
Oh yeah, that must be hard.
And so that put an additional strain on us, because guess what? You had to get on the phone to call someone instead of talking to someone in the room. That was hard, The good part though, which I would say is the good part, is you only had emergencies in the emergency department.
Okay. Everyone else was
that was a relief, because of the lockdown, we had emergencies. And so our volumes went down quite a bit in terms of, because the ER in the United States is actually a primary care center for most people because of the way our healthcare system runs. They don't have a primary care doctor, so everybody comes in there for everything. And sometimes, I think emergency medicine is the stepchild of medicine. It's stepchild. So everybody just says, go to the ER. I can't talk to my kids, go to the ER. I don't have a job, go to the ER. Everybody comes to the ER as if we have all the answers, and we don't. So that little part was gone. I must say, in the last 4 weeks or 5, that things have started opening up, it has been awful. It's almost like people have stored up their whole kind of my emergency room things, and they're bringing it, boom, as well as having sick patients. So, and even with the protests and even with the other things coming in, the good thing is I work in a small community, so I don't have to deal with injuries that other ERs might be dealing with, from riots and whatnot. So, yeah. I think the main thing on COVID is its toll on families, because some families couldn't be with their loved ones in critical conditions, like almost at the last minute, you let them come in. We don't have so many deaths in our ER because we're small and because we are a critical access hospital, which means we transfer or we admit to our hospitalists a little faster than the humongous ERs where they have like 20,000 beds. In my ER, I don't even know how many beds we have, but if I think on top of my head, we have less than 20 beds. So we're small. Some ERs have 20 beds in one pod and they have 4 pods, which means they have 100 beds or 60 beds. We don't have that much. So my take is kind of different because remember, America has the big hospitals, then the teaching hospitals, then you have the community hospitals, then you have the little bitty community hospitals. So the hospitals are almost related to the volume or the population, sorry, of their catchment area. Like my hospital is in a small town of less than 11,000 people.
Okay.
So it's kind of different.
Okay.
Although there's some centers that are in rural areas that are big because they have a wide area to cover. Yeah.
Okay. Okay. So how have you been dealing with the like you talked about the ever-changing recommendations? It seems like everything is kind of streamlined now, and it's kind of like, so do you still have that rapidly evolving?
I think I can't say, okay, let me give you 2 examples. Everybody that comes thinks they need to have a chloroquine prescription, hydroxychloroquine, because everybody gets their health advice from CNN, Facebook, you know what I mean? So they come in and like, well, can I get a prescription for Zithromax and hydroxychloroquine? And I'm like, I can't. It's not, I mean, you know what I mean? It's like, the funny part, which is not funny, the Lancet, I believe, or one of the British journals that published an article about the efficacy of hydroxychloroquine has withdrawn their article. You know what I'm saying? Like, they've withdrawn it. And it's like, in these 3 months, they put it out and everybody was basing stuff on it. They withdrawn it. The truth is nobody really knows. And then the second part is the issue of the mask. Oh my goodness. The thing about the mask that is amazing is before COVID, we wore masks. We wore masks for surgical procedures. So we had surgical masks for the most part. We had N95 mask, which is the ultimate mask that filters out 95% of things that can come into your respiratory system. But with COVID, having to wear masks, there's so much controversy on it. For instance, in my ER, if you come in with a respiratory complaint, you have to put on a mask because we don't know if you have COVID or not, and we do not want it to spread. All healthcare workers wear masks when we see patients. We wear the N95 if you have to do procedures like intubating or things that will cause aerosol of respiratory droplets. Some people refuse to wear masks because they get their information from social media or whatever and say it doesn't work. But the question is not whether the mask works or not. The question is, a mask prevents droplets from being spread. Just like when I would suture a patient, I would wear a mask so that when I'm suturing, my droplets before COVID doesn't go into the patient's wound. You see what I'm saying? So those things are just amazing. And you can even tell the level of defiance of a person when they look at you like, I can't hear you. And I'm like, I have to wear a mask. Because the mask muffles when you talk. I started wearing masks since January because I got the flu in January, and we had a lot of children with the flu at the time, and I was like, I'm not getting the flu again. And so I started wearing masks in January, not because of COVID. And then when COVID came, I was like, oh my goodness, we have to put on the mask. And it's almost like, it's amazing how many types of masks there are. Colors and
designs.
Yes. But we wear medical masks in the ER. We don't wear cloth masks at all. That's not our norm. We wear cloth masks. Maybe in our private lives. I wear cloth masks in my private life. So I do not wear medical masks in my private life. I wear masks that I wash and stuff like that. Yeah.
Okay. So are you seeing a reduction of COVID positive patients in your facility? Or it's because we've been hearing reports of, with the opening up of certain communities, there have been spikes. So first of all, has your community been opened up, or is it still?
Our community is, I would say, I don't follow the news, but I can say it's open. I'm looking at my window and I'm like, everybody's outside. I think my community is opened up, and you have to wear a mask to go into establishments. Some establishments won't let you come in without a mask. You have to wear a mask. I think now some grocery stores will not allow you entrance without a mask. Doctors' offices will not allow you without a mask. Beauty parlors and stuff will not allow you without a mask. So for the most part, most establishments will not allow you without a mask. Okay. So I think the numbers game is hard for me to tell you, but I can say that more than ever, people that don't look like the catchment for COVID are getting COVID more now. In other words, you know what I mean? Like regular folk, not the outlying person that has diabetes, hypertension, not the ones that are supposed to be high risk. The non-high risk patients seem to be getting it more because people are not social distancing. You know what I mean? Like people are going to the park, they're having parties. I don't think their bars are open, but they're, for instance, I think it was Memorial Day.
Oh, that was a mess everywhere.
You know what I'm saying? Like,
the beaches were full.
You know what I mean? So there was no social distancing. And so many of the people that are out there are actually the healthy people, but the thing is, they may be healthy, but if they get infected, they might get the worst part. The thing with COVID is most of us are probably infected by now. The question is not whether we're infected or not. The question is, what happens when you get infected? We have no way of saying whether you're going to get well or not. You see what I'm saying? Like, there are celebrities that have had it, and there are celebrities that have had it and have died. Why did they die? Is it in their genetic code? What is it? Because not everybody has outline or things that you can measure. Not everybody is there are people that have had the hypertension, the whole 9 yards, that survive. Why did they do that? The people that have been on the vent survived. That means they were intubated, breathing for them, survived. And the people that didn't get that bad, but died. Why?
Yeah, I know in my community, there's a gentleman that was actually on the ventilator for 50 days.
Okay.
And he's out now.
That's right.
First he was discharged from there to the hospital, but he's back home.
Yes.
It's amazing. It's amazing. You've been talking on and on about the mask. I know in addition to the physical mask, the surgical ones or the cloth ones that everyone is expected to use, you also have a derivative of that. It's an acronym. So can you please share that with us?
Okay. March 2nd, I flew from Baltimore to Louisville, Kentucky. That was my last plane flight. So I'm on the flight, and my neighbor was this gentleman with the big, huge box of wipes. So he hands me the wipes, and he started wiping everything. So I did the same without understanding what I was doing. So I'm wiping, he wiped the whole seat and everything. So I wiped it, and he kept saying, we need to clean this stuff. At that date, there was COVID, but it wasn't like the way it was. Within 2 weeks of that date, I realized, oh my goodness, I can't handle this, because the ER was overwhelmed. We didn't have our normal rules about COVID. We didn't have visitors. Everything was changing. I was scared I was going to get it. I didn't want to give it to my family. There are many things at the time. And as we wore those masks, and we had the PPE, which is the personal protection equipment, I realized that the part that nobody seemed to talk about was our minds. Because my mind was like, I have never, ever been scared going to work in my life until COVID. I was terrified to go to work. I went, because I'm responsible, but I was terrified. And then it dawned on me, if I'm terrified, how do I do my job, and how do I interact with my fellow team members? And the physician is the head of the team. So I'm like, I got to do something. So I came up with the mask, which I do, and I've done since. The M is for meditation. The reason I had to meditate is all them toxic ants in my head. Ants is the automatic negative thoughts that come about, am I going to die? Am I going to catch it? Am I going to give somebody, that type of thing? Helps me kind of set my intention to be the best that I can be, not anybody else. My meditation helps me be aligned to my core values so that I can, out of inside of me, bring out the resilience, the courage, all the things I need to be my best self. So I do that every morning. And the days I don't do it, I know when I get to work, it's not pretty. Then the A is affirmation. A lot of times we get offended when we feel that we're not heard. My antidote to that is, in the morning, I look in the mirror and I say, come on, girlfriend. You are kind, so don't worry about it. You are bold, so get on with the work. You are authentic. You can't fake it till you make it. You gotta be for real. And I slap myself, look in the mirror, brush my hair or shave it, whichever. And then the one that really trips me is the sleep, the S, the sleep. Because I work night shift and I don't treat my days like my nights. I work 12-hour shifts. My drive is 1 hour both ways. So when I work, I have a 14 hours out of 24. And by daytime, I'm trying to build my other business. I'm trying to be everything to everyone. And so I try to catch sleep. And when I work, the most I get to sleep is like 4 hours, because I just can't sleep. I want to talk to everybody in the daytime, but sleep is so essential. On the days that I don't work, I sleep. I sleep 8 hours, sometimes I sleep 10. The K part is the one that really, really I'm working on, is being kind. Because when crisis comes, the tensions are high. And for me, I'm a people person. And I've noticed that the level to which I am kind to my teammates is the level to which I'm kind to myself. For us to have the kind environment for our patients, we have to be kind to ourselves first. Just like they say in the airplane, you put the mask on yourself first. Isn't that amazing? The airplane, they tell you to put the mask on yourself first, the oxygen mask, before you help another. And I think because I fly a lot, I understood that if the airplane tells you to do that on every single flight, they tell you, every single day, when Dr. O is going to serve, she better put on her mask over her mind. Otherwise, she'll lose it. And if she loses it, the team is going to lose it. And if the team loses it, the patients are going to lose out. You know what I'm saying? Like, you can't serve your patients and your community if you don't have your mask on.
So thank you so much for that. It's crucial, it's important, because one of the things that I've been very, very concerned about with regards to this pandemic, which I've been alerting those around me, every place I've had a voice, I've been alerting people to, is the mental health fallout from this. Because even right now in the midst of it, we're seeing a spike, we're seeing an increase. People that had never had mental health symptoms before are starting to see signs, and those that already had a pre-existing condition, it's been worsened from all the fear and the anxiety of the pandemic, in addition to the social distancing. So all these factors have compounded already, some already chronic or some that were even mild before. And they've started to run some of the numbers, and about 54% of Americans have begun to exhibit at least one symptom of a mental illness. And when they did a survey, they discovered that about 56% of healthcare workers had issues with anxiety and depression. So it's so important what you're talking about, the fact that the mind is the most important one, and each one of us has to start with ourselves before we can help another, especially for those in a caregiving position, either as healthcare workers, as care providers at home, maybe for someone who has a special need, or someone who's sick, even maybe at home sick from COVID or any other health condition, even as a parent with your children, because even the children too, there's been a spike in anxiety among them. Anxiety it has always been the major mental health disorder for children and teenagers, and there has been a major spike for them as well. Because there was a time I spoke to a mother some months ago, and I asked how her child was doing, and she was like, "Oh, she's fine." And I asked her again, I said, "How do you know she's fine?" And she was like, "Oh, I asked her and she told me she was fine." I said, "No." I said, "What did you ask her?" She said, "Oh, I always ask her, how are you doing?" I said, that's the wrong question to ask, because even as we were kids, through role play, we were taught, I'll say, "How are you?" You respond, "Fine." So we've been conditioned all our lives that the response to "how are you" is fine, even when we're not fine. Even when we know we're not fine and the person asking the question knows we're not fine, we still respond fine. So I told her to ask her open-ended questions, ask her what her thoughts are concerning what was going on, how she was feeling, have her journal it if necessary. So she got back to me some weeks after that, and she was like, "Oh my God, thank you." This was a 6-year-old child. She had her journal it, and the first thing the child wrote was, "I'm scared." And what was she scared about? She was scared about her mother contracting the virus and dying. So all this while she'd been responding to her mom, "Fine, I'm fine, I'm fine." That was building up on the inside. So we need to realize that the main area or the major battlefield in this war against COVID is actually the mind. We have to, as individuals, as Dr. O has said, we have to put on our mask first. We have to meditate. We have to affirm ourselves. We have to make sure we're getting enough sleep. We have to be kind to ourselves first and then to others. That way, we will now be able to help those around us put on their masks and help curtail the spread of the panic and the fear. I mean, it's hard, even though with all the racial unrest going on, it seems like nobody's really talking about COVID anymore, but there's still people that are petrified to leave the house. There's still people that they can't go shopping. They even when they have a need to go. I mean, I know someone that was sick, but refused to go to the ER. Why? Because of the fear of COVID. But they needed to go to the ER with the symptoms they were having. I had to convince that person to call 911. You know, so those are some of the things that we're having to deal with. So Dr. O, I really, really want to thank you. I'm reading through some of the notes on YouTube. Someone says, "Good day, Dr. O. Good to hear your thoughts and perspective. Thanks for sharing." Another one says, "Well done, Dr. O." And then someone says, "It starts with me. I wear 2 masks, one physical and one mental. Meditation, M for meditation, A for affirmations, S for sleep, and K for kindness." And another person says, "Thank you for hosting, Tony, and for reminding us to protect our minds." So Dr. O, before we round up, do you have any last words you want to share with us? You've really, really encouraged us and affirmed us.
I'm going to say this, and I think the most important thing, especially as we're navigating more than COVID, you know, is to find the courage to be real. Find the courage to be real. I'm just going to drop 4 things. In our relationships, we have to be real. We have to exhibit emotional intelligence. Everything that comes into your head does not have to come out of your mouth. Mm-hmm. Some of us, including myself, have to go back and look on the inside and ask ourselves the hard questions. Should I have said this? And some of us are silent for too long. We need to open up our mouths and speak. Words without action is cheap. If you say you love me, if you say you love America, if you say you love your fellow man, act like you do. Because if you don't act, it's all fake. If you come out of smoke, you will smell like smoke. If you come out of a perfumery, you will smell like perfume. If you check your life and you smell like smoke, it means you've been in a smoke area. If you check your life and you smell like perfumed flowers, it means you've been in a garden. My charge to each of us is this: as you wear your mask, as you navigate COVID and other issues in our country, please be real. It takes courage. It takes courage to be real. because we're in this boat together. If the boat floats, we're going to enjoy the ride. And if it sinks, we're all going to sink. Some of us will sink faster than the others, but we're all going to sink. Please social distance. We don't want a resurge of COVID because some countries of the world are getting a resurgence after they reopened. My name is Folake Oluokun, and I love you all. Thank you.
Thank you once again, Dr. Oluokun, and thank you to everyone else who joined. We really appreciate this time with you. And as she said, remember to put on your mask, remember to meditate, remember to affirm yourself and those around you, remember to get enough sleep, and remember to be kind to yourself and everyone around you. So thanks once again for joining us on More Than a Phase with Toyin Fashion. Thank you, Dr. Oluokun.
Thank you, Toyin. Love you lots.
Love you too.
Bye, little sis.
Bye, big sis.